big part of what the leadership in the Department of Surgery is dedicated to is getting to know the residents really, really well, understanding what brings them joy to their life, understanding what parts of surgery they really enjoy, and then putting them in a position where they could be successful.
We have every Wednesday. It's a secured, protected time from 7 a.m. to around noon, which is nobody can page you in that time. Nobody can talk to you about anything other than your education. And once a month, we do a well-being program where we go somewhere and it's just for fun. We do fun stuff and talk about our problems or anything.
But there's also non-structured learning as well, where residents teach residents and then attendings teach residents.
A more senior resident will kind of prepare a lecture and kind of teach the younger resident, which I think is not only, I guess, really important, but kind of a nice learning model because, residents kind of know what's kind of important and they're a little bit closer to what we need to know and kind of prepare us for AppSite. So they kind of gear that education towards that.
As interns, we had Aztec Lab, which is like training, surgical training skills lab, and we had it throughout the year, and that was helpful because then you learn things that you may not necessarily learn before, like types of sutures, how to do passes,
This is my chief talk. We're going to be talking about topical agents from hemostasis. I have no disclosures and no conflict of interest.
Wounds that were open and draining, and there was nothing that was obvious that was concerned for like a necrotic soft tissue infection.
And that's where I was born and raised, and had a completely different upbringing than theirs.
The first day of surgery to orient your incisions parallel to these lines on the left, which are Langer's lines, and these are lines of minimal skin tension.
The most amazing thing I went to the OR on my really first few hours of training when I came in here. This is really amazing. Lots of OR opportunities. It's all about operations here. Once you finish your floor work, you're good to go, and there's plenty of surgeries.
the fact that we don't have fellows was like a really big selling point, or we have very few fellows, and so that allows like us as residents to do big cases that other programs would otherwise go to the fellows. We get a ton of operative exposure there. So the level of experience that we gain is like phenomenal, and the people that we work with there are also phenomenal.
I love being in the operating room, I really do. And the more skills you develop, the more you love it, and the more sides you see of the complexity of operating and what it takes to be a surgeon.
I think that it's a great program that provides a well-rounded experience that creates safe, confident surgeons that will get you out into practice and to be very, very well prepared to do so.
We have people going into minimally invasive surgery, people going into trauma, others going into cardiothoracic surgery, which is what I do. But then there's some people that go straight into practice and they feel comfortable doing that. They're going into either go work in a community that they came from or go to a different city. And we have some that have gone on to like military service. So I think really we set people up for kind of whatever career they want to go into.
While in a very safe environment that you can address, your personal, individual needs as a human being,